3 weeks ago, a 67-year-old man walked into my office with dangerously high blood pressure, chronic fatigue, and prostate inflammation that wouldn't respond to treatment. When we finally talked privately, he confessed something that changed everything. He had a habit. A bathroom habit. Same time every day, same way every time. And he had absolutely no idea this habit was destroying his heart, damaging his prostate, and killing his ability to feel pleasure. I'm Dr. Natalia Parker, and what I discovered that day applies to thousands of men over 60 who are making the exact same mistakes right now without knowing it. This man, let's call him Robert, wasn't doing anything he thought was wrong. He was just doing what he'd always done. Except his body had changed, and those old habits had become silent destroyers. By the end of our consultation, I'd identified not one, not two, but 5 critical errors he was making during masturbation. And before you think I'm about to lecture you on morality, let me be crystal clear. There is nothing wrong with masturbation. It's a normal, healthy part of sexuality at any age. The problem isn't the act itself. The problem is how you're doing it. Because after 60, your body doesn't work the same way it did at 30 or 40. Your circulation has slowed, your testosterone has dropped, your prostate has enlarged. All of this is normal, expected. But if you keep doing the exact same things you did 20 years ago, you're creating problems that will catch up with you. And they will catch up violently. I've seen it happen hundreds of times. Men who thought they were fine, men who had no symptoms, until suddenly they did. Heart arrhythmias, severe prostate issues, complete loss of sensitivity, inability to perform with their partners, all preventable, all caused by 7 specific mistakes that almost no one talks about. Why am I telling you this? Because I'm tired of watching good men suffer in silence with problems that could have been avoided. Because sexual health after 60 isn't a luxury, it's essential to your overall well-being, and because no one else is going to tell you this honestly. So here's what's happening to your body right now, whether you realize it or not. After 60, blood vessels become less elastic. Nerve endings lose sensitivity. The cardiovascular system takes longer to respond and longer to recover. Your body is like a car with 30 years of mileage. It still runs, it can still perform beautifully. But it needs different care now, different maintenance. If you drive it the same way you drove it when it was brand new, you're going to break something critical. And here's the thing most men don't understand. The damage happens gradually, invisibly. You don't feel it happening until it's already severe. That's why Robert came to me with high blood pressure and prostate problems. He thought they were separate issues, age-related, random. They weren't random at all. They were directly connected to habits he'd built over decades, habits his body could no longer handle. So let me walk you through the 7 most dangerous mistakes you might be making right this second. Mistake number 1, using excessive pressure. Robert confessed something to me that I hear constantly. Over the years, he needed to grip harder and harder to feel anything. "Doctor, it's like I've lost all sensitivity," he said. And you know why that happened? Because he literally trained his body to only respond to extreme stimulation. Think about it. When you squeeze too hard, you're compressing blood vessels, restricting circulation, and over time you're damaging the nerve endings themselves. It's like you're slowly killing your body's ability to feel natural pleasure. After 60, your nerves are already less sensitive naturally. If you add excessive force on top of that, you're digging your own grave in terms of sensation. And here's something most men never realize. That excessive pressure can lead to what we call death grip syndrome. It's not literal death, obviously, but it is the death of your ability to respond to gentle, natural touch, whether that's from your own hand or from a partner. Have you ever stopped to think that maybe your difficulty feeling pleasure with your wife isn't her fault or yours, but simply the result of a habit you created without realizing it? I had another patient. Let's call him Carlos, 64 years old, married for 35 years. He came to me desperate because he couldn't perform with his wife anymore. "Doctor, I just don't feel anything," he told me. After talking extensively, I discovered he'd been using a male masturbator device with absurd pressure settings. His body had literally forgotten what natural vaginal touch felt like. It took months of retraining before he could feel pleasure normally again, and that's just the first mistake. The second one is even more common and just as destructive, making it a bathroom habit. I know what you're thinking. Doctor, what's wrong with that? It's the most private place in the house. Yes, I understand, but let me explain what's actually happening to your body when you do this. First, the position. Most men do this sitting on the toilet, right? In that position, you're completely compressing your pelvic region. The blood vessels that supply your penis, your prostate, that entire area, they're all under pressure. After 60, your circulation is already slower naturally. Add this compression and you're creating a serious problem. Second, the rush. In the bathroom, nobody wants to take their time. So you speed up, you tense up, you breathe poorly, your heart races, your blood pressure spikes, and you don't even notice. I've seen cases where men had cardiac arrhythmias, even early signs of heart attack, all because they were straining too hard in a closed space with poor ventilation. Third, the psychological association. When you always do it in the same place, your brain creates a fixed pattern. After a while, you can only achieve pleasure there. This severely limits your sexual life. If you want to have an intimate moment with your partner in bed, your brain doesn't respond the same way. You've literally conditioned yourself to one specific environment. Now, mistake number 3 is the champion of problems, rushing the process. Did you know that most men over 60 I treat take less than 3 minutes from start to finish? 3 minutes. That's a disaster. The male body needs time, especially after 60, for the entire cardiovascular system to prepare properly. When you rush, your heart has to pump blood extremely quickly. Blood pressure rises abruptly. You're putting enormous strain on your system. It's like running a 100-meter sprint without warming up. You might make it, but you'll pay the price afterward. Plus, rushing means you're focused only on the end point, the orgasm, and you lose the entire journey, all the pleasure along the way. Healthy masturbation, especially at this age, should be a moment of connection with your own body, exploration, relaxation, not a race against time. I usually tell my patients, dedicate at least 10 to 15 minutes, start slowly, explore different types of touch, breathe deeply, let your body respond naturally. You'll notice the pleasure is much more intense, the orgasm is more satisfying, and you avoid overloading your heart. But here's where it gets really concerning. Mistake number 4, not using proper lubrication. This is basic, but you'd be shocked how many men ignore it. After 60, skin becomes thinner, more sensitive, more prone to micro tears. If you're rubbing without lubrication, you're creating tiny fissures in the skin that can become inflamed, infected, cause serious issues. And I'm not talking about using just anything. No soap, no shampoo, definitely no toothpaste for God's sake. These substances can severely irritate the mucosa. Use a water-based lubricant designed for this purpose. You can find it at any pharmacy. It's not expensive, and it will make an enormous difference. I had a patient, let's call him Joseph, 62 years old, who came in with his penis completely irritated, red, burning. He was embarrassed to tell me, but when I insisted, he confessed he'd been using soap for years. The man was literally injuring himself. After he started using proper lubricant, within 2 weeks everything was resolved. Now we're getting into more complex territory. Mistake number 5, complete dependence on pornography. Look, I'm not going to get into the moral aspects of watching pornography or not. That's your business, but from a medical standpoint, I need to warn you about a serious problem. Dopamine. When you watch pornography, especially the more intense, extreme content, your brain releases massive amounts of dopamine. It's the pleasure hormone, the reward chemical. The problem is your brain gets accustomed to that level of stimulation. After a while, your brain only responds to that type of extreme visual stimulus. You become literally addicted. And then what happens? You can't feel aroused by your wife anymore. You can't get an erection without watching pornography. You completely lose the ability to be excited by natural, real stimuli. I've treated dozens of men in this situation, and the recovery isn't easy. There's a recent study done here that showed men over 60 who consume pornography daily are 3 times more likely to develop erectile dysfunction compared to those who don't consume it or consume it only occasionally. 3 times. That's significant. If this resonates with you, my recommendation is try a detox. Go at least 30 days without watching any pornography. The first few days will be difficult. Your brain will complain, but afterward, you'll notice your sensitivity returns. You'll start getting aroused by simple, natural, real things again. Comment below where you're watching from, because I see men from everywhere dealing with exactly this issue and not knowing where to turn. And here's another crucial thing about pornography. It creates unrealistic expectations, those bodies, those performances, that duration. None of it is real. They're actors with preparation, editing, pharmaceutical enhancement, everything. When you compare your real life to that, you create enormous frustration, anxiety that only damages your sexual health further. Mistake number 6, and this one's controversial: overusing highly intense sex toys. I know some of you use male masturbators, those devices with vibration, suction, automated movement, and look, there's nothing wrong with using these occasionally. The problem is when you use them constantly, every day, and set them to maximum intensity. You know what happens? Same thing as excessive manual pressure, only worse. These devices create such intense artificial stimulation that your brain and body become accustomed only to that. Later, when you try to have real sex with your partner, you simply can't feel anything. A vagina doesn't vibrate, doesn't have suction, doesn't have all that pressure. So you end up thinking the problem is with you or with her, when actually the problem is you've desensitized your body. I had a striking case. Let's call him Marcus, 66 years old, came to me desperate. He'd bought a top-of-the-line expensive masturbator and was using it every day. After 6 months, he realized he couldn't have relations with his wife anymore. He simply felt no pleasure. He was devastated. His marriage was in crisis. It took 4 months without using the device, doing sensitivity exercises, before he could recover natural responsiveness. If you use these devices, my recommendation is limit use to maximum twice a week, and never use maximum power. Always start on the lowest setting. Go slowly. Your body needs to stay responsive to natural stimuli. And now we arrive at mistake number 7, the one that destroys more relationships than anything else. Not balancing with real intimacy. This one's fundamental and many men completely ignore it. Look, masturbation is healthy, normal, part of sexuality, but it cannot replace real intimate connection with another person. I see many men who masturbate every day, sometimes twice a day, but go weeks without intimacy with their wife. Then when the wife complains, he says he's not in the mood, he's tired, he's having erection problems. That's not true. The problem is you're spending all your sexual energy alone. After 60, sexual recovery takes longer. If you had an orgasm this morning in the bathroom, you can be certain that tonight, when your wife wants intimacy, you won't be able to respond the same way. It's physiological. You can't trick your body. And there's another important aspect, the emotional one. Sex with another person involves connection, exchange, intimacy, complicity. It's completely different from the solitary act. When you always prioritize masturbation, you're losing something precious, which is that human connection. I had a patient, the wife of a 65-year-old man, who came to me in tears. She'd discovered her husband was masturbating in secret every day, but hadn't had sex with her in 2 months. She felt rejected, ugly, undesired. When I talked to him, I realized he'd created an addictive routine where masturbation was easier, faster, no need to worry about performance, about satisfying a partner. But it was destroying his marriage. The guidance I gave was establish a priority. If you're in a relationship, intimacy with your partner should come first. Masturbation is a complement, not a replacement. And that transformed their relationship. He started reserving his sexual energy for moments together. And when he really needed to, then yes, he would masturbate. The marriage improved, her self-esteem returned, and he realized that shared pleasure is far greater. Now, before I give you final recommendations, I need to say something important. None of these mistakes come from ignorance or stupidity. They happen because nobody taught you to do it differently. Nobody told you about the body's changes after 60. Nobody prepared you to adapt your sexual life to this new phase. And you know something? It's not your fault. Society created an enormous taboo around sexuality in older adults. People think that after 60, you no longer have a sexual life, no longer have desire, no longer need guidance. But that's an absurd lie. Sexuality has no age, desire has no age, pleasure has no age. What changes is the form, the frequency, the intensity, and you need to understand this to live well, with health, with quality of life. So, what can you do right now today to change this? First, have awareness. Are you making any of these 7 mistakes? Be honest with yourself. You don't need to feel shame. You don't need to blame yourself. Just recognize it. Second, make small changes. You don't need to change everything at once. Start with one thing: using proper lubricant, or changing location, or reducing pornography frequency, one step at a time. Third, talk to your partner if you have one. Open up. Be honest. She'll prefer a frank conversation 1,000 times over living in uncertainty, thinking the problem is with her. Fourth, seek professional help if necessary. If you realize you can't change alone, that you're addicted to pornography, or have more serious sexual health problems, see a urologist or sex therapist. There's no shame in that whatsoever. And one last thing I want to make absolutely clear: your body still works, your desire still exists, your capacity to feel pleasure is still there. You just need to learn to respect the natural changes of age and adapt your habits accordingly. I've seen men at 70, 75, even 80 years old completely recover their sexual lives after making these changes. Men who thought everything was lost, that it was just age, that there was no solution. It's not true. There is a solution. Your body deserves respect, deserves care, deserves attention. Replace shame with curiosity, replace fear with knowledge, replace rush with patience, and you'll see that sexual life after 60 can be just as good or even better than before. If this content helps you, if you value this type of honest information that almost nobody explains clearly, subscribe to the channel, because here we talk about what most people won't address with this level of honesty. And look, if you recognized any of these mistakes in yourself, you're not alone. There are thousands of men in the same situation right now. The difference is you now have the information to change it. Use it wisely.